Hello everyone, my name is Dr. Ray Butts and I'm a physical therapist at Symmetry Physical Therapy. We're a concierge physical therapy practice in downtown Miami that specializes in one-on-one treatment with a doctor of physical therapy without the help of students, aides, or techs. Another way that we are uniquely different at Symmetry Physical Therapy is that we make a consistent effort to package the evidence-based components of multiple conservative rehabilitation strategies into each patient that we see. Today, I want to give you a better idea of why this is so important. Oftentimes, patients move their joints in ways that alter their position or change the articulating structures in some way, and this includes the small joints that make up the spine. If the joints are not right, imagine what would happen to all of the muscles that attach to or are associated with these joints. Hopefully, you can see how this situation would lead to a problem whereby these muscles are now being stretched, pulled, torqued, or compressed in a way that is inappropriate. If this occurs, these muscles are now continuously living in an improper position, which causes the stimulation of type 1A and type 2 neural afferents from the muscle spindles, which can be found in the non-contractile component of muscle tissue. These nerves feed back to the central nervous system and stimulate alpha motor neurons that are responsible for causing muscles to fire. The purpose of this protective strategy is to push the muscles to fire in an effort to regain their normal resting position. In the event that the joint where these muscles attach is not correct, however, it's not possible for these muscles to regain their normal resting position until the joint or joints have been treated. As a result, these muscles are told to fire over and over and over again, despite the fact that their position cannot change, which results in hypertonicity. Muscles that are firing more than what they should at rest. This situation leads to hypoxia and the release of inflammatory factors, which inhibits an enzyme called acetylcholinesterase, an enzyme that primarily works to clear acetylcholine from the neuromuscular junctions. Given that acetylcholine is the very chemical that nerves use to tell muscles to fire, this neurotransmitter is always present to drive excessive muscle activity, which propagates the hypertonicity or the excessive muscle firing, leading to trigger point formation. This creates a situation whereby patients not only have joint problems, they also have muscle problems. As a result, we must use mobilization and manipulation to quiet the alpha motor neurons, break the cycle of hypertonicity, and return the muscles to their proper resting position. We then use electric dry needling to elicit localized twitch responses, which clear the excessive acetylcholine from the neuromuscular junctions, thereby disabling the physiology associated with the trigger points. Importantly, however, electric dry needling is used for much more than treating trigger points. Here at Symmetry Physical Therapy, we use dry needling to treat tendons, ligaments, connective tissue, scar tissue, perineural tissue, and yes, muscle tissue, as all of these structures are associated with various neuromusculoskeletal conditions. In reality, dry needling is based on the mechanical stimulation of tissues, more formally referred to as mechanotransduction. That is, we leave multiple needles in patients' tissues over a period of 8 to 30 minutes, as that's what's considered to be evidence-based. And we provide manual and electric stimulation of the needles so as to push the cells that make up the tissues to produce and release chemicals such as opioids and adenosine to drive the pain down, but also to make the raw materials that are required for a more efficient repair. For example, part of electric dry needling is to push the cells that make up the problematic tissue to make Rho and RAC kinases, which break down the skeleton of the cells and allow us to remodel the tissue, making the tissue look more like it used to look when it was asymptomatic or healthy. Additionally, electric dry needling has been shown to decrease inflammation and increase blood flow via vasodilation, which is also required for more efficient repair and rehabilitation. In the case of joint osteoarthritis, electric dry needling has been shown to increase blood flow by up to 70% and even stop and or reverse degenerative changes associated with that arthritis. As such, we have found it to be particularly powerful when used in conjunction with PRP and stem cell injections. Our goal at Symmetry Physical Therapy is to be able to use techniques like electric dry needling to stimulate the peripheral, spinal, and supraspinal nervous system so as to change the way that pain is being processed in your body, so that you can eventually get back to doing the things that you love most. If you have additional questions about the type of treatments that we provide at Symmetry Physical Therapy or the associated physiology of those treatments, please come and visit us, or at a minimum, give us a call. Let us prove to you that we can efficiently treat your condition in a way that is meaningful to truly get you back to doing the things that you love most.